Chapter 3, Composite Resins, describes the advances in adhesive restorative biomaterials that have resulted in adhesive restorations that provide increased retention, marginal adaptation, and reduced microleakage. This evolution in the development of adhesive dental technology with adhesive materials and in techniques has dramatically changed the limitations of directly placed composite resin restorations. This chapter provides a brief discussion of the infrastructure of composite resin. It describes the major limitation, polymerization shrinkage, which is associated with shrinkage stress, the mechanism for the clinical challenges with adhesive restorations in clinical dentistry. Various methods and clinical techniques are provided to show how to manage and combat these undesirable effects. Clinical applications of various composite placement techniques are provided with detailed photographic and written explanations of the biomaterials used and how to use them for optimal results. Instrumentation and materials are provided in each procedure. From simplified to more advanced layering techniques, the entire protocol for composite procedures from Class 1 through Class 5, including direct veneers, are vividly and precisely illustrated. Chapter 4, Ceramic Materials, provides a brief historical perspective of the evolution of ceramic materials. A description of the mechanical properties that are significant in evaluating the clinical performance of ceramic materials is provided. A classification of the all ceramic systems is provided with a table illustrating each ceramic system's clinical application, thus simplifying the decision-making process for clinicians, technicians, and their patients. The clinical illustrations provide step-by-step procedures for laboratory fabrication, surface preparation, adhesive protocol, and finishing procedures using these various all-ceramic systems. Chapter 5, Elastomeric Impression Materials. The most critical elements in the impression process are selection and technique. This chapter defines and describes the most significant physical characteristics of elastomeric impression materials. A working knowledge of these properties can be beneficial in the selection of the proper impression material for a specific clinical situation while providing answers to restorative challenges related to impression taking. A description and comparison is provided for the most popular elastomeric impression materials. A table is provided that identifies the advantages and disadvantages for their application in a variety of indirect procedures in prosthodontics and restorative dentistry. Also, a description of the gingival tissue architectures provides clinical suggestions for tissue management during the preparation, provisionalization, and impression taking stages. The clinical illustrations provide step-by-step photographic and written descriptions of the double core gingival displacement technique, a method for precise placement of finish lines of the preparation, and the determining factors for predicting the post-restorative gingival margin levels and periodontal health after preparation, gingival retraction, and impression taking. Chapter 6, Contemporary Adhesive Cements, paints a brief overview of eluting cements. A contemporary classification of adhesive cements is provided with a review of each type of the most currently utilized adhesive eluting cements and their characteristics. This chapter will furnish the clinician a guide for selecting the optimum eluting agent for use in different clinical scenarios. The clinical illustrations provide a thorough understanding for the selection of adhesive cements and the utilization of the cementation procedure. A step-by-step adhesive protocol illustrates surface preparation of the tooth structure and different ceramic microstructures with various applications of eluting cements. Chapter 7, Provisionalization. The interim restoration has become an integral component in the development and management of soft tissue profiles and for the design of the definitive prosthetic restoration. This chapter describes the clinical objectives of the provisional restoration and clinical requirements for developing an optimal interim restoration. A description of the provisional materials available, the clinical considerations for their use, cementation, and even the advantages and disadvantages of each are provided. This allows the clinician and technician information for the proper selection for a required clinical situation. The clinical applications include direct, semi-direct, and laboratory process provisionals. Fabrication, finishing, characterization, and cementation procedures are included for provisional veneers, crowns and bridges, using self-polymerizing acrylics, and the contemporary self-cure, dual-cure, and light-cured provisional materials. Also, a great way of developing functional composite prototypes prior to veneer preparation is photographically described in detail using a semi-direct technique. This allows you to have the patient test drive the prototype before completion of the final restorations. Chapter 8, Aesthetic Post Systems. There are a variety of user-friendly post-in-course systems for different endodontic, restorative, and aesthetic requirements. This chapter provides the general design criteria and the components of different systems for the evaluation of any post-retained system. It provides the design principles that should be considered for the selection of any post-retained system and provides a simplified table of those design principles for the adhesive post-retained system. The clinical techniques section begins with the photographic illustrations and written description of the significance of the ferrule effect. This development of a coronal tooth collar of 1 to 2 millimeters on sound tooth structure provides mechanical resistance and retention form for the endodontically restored tooth complex. A detailed photographic description of the direct fiber reinforced post-in-course system using various applications of biomaterials is illustrated for numerous clinical situations on the anterior and posterior dentition. Every step is photographically illustrated so the clinician and auxiliary has a thorough and visual understanding of the adhesive procedure. Chapter 9, Mechanisms of Adhesion. Advancements in biomaterials and adhesive technology, along with the progression towards conservative, less invasive dental procedures, require a thorough knowledge of the micromorphology of dental tissues. This chapter, Mechanisms of Adhesion, provides a complete understanding of the unique characteristics of enamel and dentin tissues, which is essential for the optimal adhesion of the different array of restorative materials to these surfaces. It provides the clinician with a description of the morphological, histological, and physiological characteristics of the dental tissue substrates, explains the interplay between biomodification of the tissue and adhesion, and gives a review of adhesive strategies at the restorative interface. Also, it provides specific clinical criteria necessary for improving adhesion at the interface. In this chapter, detailed clinical applications illustrate the adhesive protocol for rebonding fractured ceramic restorations and repairing fractured composite restorations. And not one photograph is omitted. Both total etch and self-etch protocols are described in detail for the placement of direct composite restorations and the cementation of inlays, crowns, and veneers. While each illustrated clinical procedure provides the biomaterials, instruments, and the specific criteria to achieve a durable interfacial adhesion between the tooth and biomaterial.